Okay, we're live. Yep, sound on. Yep.
Sounds on.
Yep, you can go.
Well, good morning, everybody.
It will be a test.
So one of the things that we've been talking about in the issues class is health literacy and pastoral health. And so one of the things I thought we'd start out on is having a series of topics around health-related issues. And one of the issues that's really getting a lot of attention is health literacy. So I wanted to address that today. So we talk about ways to become a better consumer of health information. One is to really have good health literacy. You need to be able to understand the information that you're getting. You need to be able to have an understanding that you're able to apply it. So just a quick survey. How many of you have ever been confused by something your doctor said in an office? I have that experience quite often. Or you might have found, we were just talking about this, you were on the news and one night red wine is good for you, the next night red wine is bad for you. You know, you're getting kind of mixed information on things that you see on news media. Quite common that happens. And I think we're all familiar with the challenge of health literacy as it related to COVID-19 and how it was really oftentimes politicized. So we'll talk a little bit about how health literacy and advocacy and an engaged patient really work together in a synergistic way, both for good things and for bad things. So if we look at health literacy, what we're really talking about is not only understanding information, but to be able to understand it in a way that you can utilize it to become a better patient, hopefully to have better outcomes. One of the things that the Department of Health works on, they develop a strategic plan every 10 years on what are going to be the priorities for the country when we look at improving health. One of the major ones that we're working on now is Healthy People 2030 is a health literacy program. They recognize that to be able to have a healthier population, you need to have a population that's informed about healthcare issues and is able to go out and get good information and apply it. And they really divide it into two different priorities. There's obviously the patient aspect. So a personal health literacy is the degree to which individuals have the ability to find, understand, and use information services to inform health-related decisions and actions for themselves and others. It's really part of that whole empowerment of the patient. And there's a lot of topics as we talk about health issues in this class. An empowered and engaged patient is a critical piece of any initiative to improve health. But there's also the need for healthcare organizations to do a better job of getting appropriate information out to the patients. So the definition for organizational health literacy is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So it's not simply enough, to just kind of put it out there using, health jargon and information that's not applicable. You need to make sure that it's appropriate for the culture and the education level of patients that you're dealing with. It's really looking at equity. So the goal is to get everybody to a level that they're able to get information that they understand and use to improve the health outcomes of the country. So here's the test portion. So grab a piece of paper and a pencil, and there's a lot of validated measures that people use for looking at health literacy. I picked this one. This is the Brief Health Literacy Survey Screening Tool because it's really quick. So there's 4 questions. These are the first 2 questions. So what you want to do is just on a Likert scale, 1 being always, 5 being never. These are the first 2 questions. So we'll just take a few minutes to answer these questions, and then we'll move on to question 3 and 4.
On your written position, is that handwritten from the doctor or is that printed?
Now, think about it. You don't have any problem reading it.
If it's handwritten from the doctors, it's always.
I would have that same problem with my own handwriting, so yes. Yeah. Assume it's printed in size 18 font, it's very easy to read.
Okay.
That's not an issue. All right, here's questions 3 and 4. So it's a self-graded exam, so you can look at these. So you want to add up your 4 scores. And what this is really kind of looking at are those that would fall into a limited category. That is, they're not able to read a lot of the health literacy and health information that they receive in a way that they're able to effectively use it. And so when organizations have a population that may fall into this limited area, they really need to use alternative ways of communicating with patients. Oftentimes those are using illustrations, videos, other tools that might be applicable to get that information across. Marginal, I think a lot of well-educated people that are, can read and understand information well, but maybe don't have a health background, oftentimes fall into that. And then adequate are people that are probably pretty informed about their condition and don't have issues filling out those. And in that case, there's probably less need to use some of these other tools for patient education. But one of the things that the Healthy People 2030 is looking at is trying to make sure that we're assessing the health literacy of our patients as a health organization, that we're making sure that we're understanding where they stand, because oftentimes patients aren't going to raise their hand. I don't understand the thing you're talking to me about. Oftentimes they'll just sit there and nod their head, yes, 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 and then they leave and they don't know anything about what happened. So that engagement with the healthcare organization is not particularly effective at moving forward. So if we look across the status of the U.S. using similar tools to the brief survey that we just did, you find that only about 12% of the U.S. population falls in that level of they have an adequate level of health literacy to really understand what that information is. About 77 million had difficulty accessing or obtaining adequate healthcare information because of their inadequate health literacy. And then there's also a demographic that's impacting this. So what we find is that the lowest health literacy is found in those aged 65 and older, probably the population most often seeking healthcare information. So that's a challenge. And that's true even for people with a fairly high level of education. Part of it is the complexity of the diseases that they're dealing with. And it becomes worse when you start to have patients that with cognitive decline. So informing and educating those patients oftentimes requires use of a partner or a navigator, somebody that's going to help them. Here's what we talked about, but somebody else heard that information that they're able to then access after the visit to be able to use that information effectively. One of the things that we're finding now is with this move to telehealth, that's a real challenge. Oftentimes you have a telehealth visit, and the first half of the telehealth visit is trying to figure out how to turn on the audio on a visit so that people can talk. That's one of the challenges. And so when you're dealing with a larger rural population that we're dealing with, when we look at tools such as telehealth and these virtual visits, making sure that it's not only health literacy there, but there's an element of tech literacy that also needs to be involved for patients to be able to effectively be informed about their condition. So this is a study that looked at some of the covariants that occur with health literacy, and as you find and would expect, other social determinants of health are closely correlated with health literacy. So obviously, education is going to be a key one. If you have less than a high school education, you're more likely to have below basic health education. But basically, once you get to some level of college, most of those people will usually have basic or proficient health information. But you still have a population that has more than a bachelor's degree that may not be proficient in health literacy. And then also there's an ethnic and cultural distribution of it as well that needs to be taken into account. Some of it is language barriers. So language barriers in a lot of populations where English is not their primary language. Getting that information in the language that they're able to understand is really the first step that's necessary for appropriate health literacy.
Question.
Yes.
Why is it the Asian are so much better than all the rest of us?
Good question. I think that part of it is there's a fairly wide spread here, so that they have some that might be involved in a higher level of education, or they might be health-related populations. So I'm not showing the specific population that this looked at. This is somewhat older data, pulled from 2003 and 2006 as well.
I just saw that.
So there's a lot of impact when we think about poor health literacy. One of the things is that Patients with low health literacy are unlikely to seek out preventive care measures. They may not understand how important certain screening tests are, or the need to follow up on certain tests and exams that they've had previously. And so as a result, there's a higher utilization of the emergency room as a primary care source. That's true in a lot of other social determinants of health as well. Oftentimes when they do present, they're presenting at a later stage in their disease, so there's an increased risk of hospitalization. They're usually sicker when they present with their conditions because they don't understand some of the basic principles of their health care that they need to be looking out for. So the delayed access and poor quality of outcomes is one of the big impacts of poor health literacy. Part of that too is driven by poor compliance. If patients don't understand what their medications are or why they're taking their medications, they're less likely to take them. They might be finding that they have 2 different prescriptions from 2 different physicians for the same medication and not recognize that they're the same medication. So they're taking more medication than the patient. So those are some of the medication problems that we have. And oftentimes they may fail to follow up. There's a test that maybe the physician ordered, it wasn't scheduled, they're not aware how important that test is for the management of their care, and so they don't get that schedule, they don't follow up on it, and it falls through the cracks. There's several studies that showed that health literacy is really tied to health outcomes. So there's a higher mortality rate with a lower rate of health literacy. And also higher complication rates. Think about the management of diabetes. You have to be a fairly informed patient to be able to carefully manage your diet, your exercise, your medication, all those things that are necessary for a complex disease like diabetes. So health literacy is really a critical component for managing a lot of these longer-term chronic diseases that we're finding in our population. There's a greater healthcare cost that's driven by this. So economic estimates say it's probably somewhere between $100 and $240 billion annually or go to provide health care that's really counteracting the impact of this poor health literacy. Part of it is the higher utilization of ED and less effective care, poor medication compliance, higher complication rates. All of that drives greater expense when we think about the cost of delivering the care in a population that has low health literacy. And one of the things that we'll be talking at the later session is how it relates to a diagnostic errors. And that's an area that I'm particularly interested in. But that really is the failure to make an appropriate diagnosis for a patient's condition. And that really relies on an informed patient that's aware of their condition, that recognizes the symptoms and is able to communicate that information to the provider in a way that they understand, here's what's happened to me over the last couple of days, and that allows the physician to have a better understanding of what the potential diagnostic causes for the condition might be. One of the things that we saw during COVID also is that when you have a population with low health literacy, you increase the risk of health misinformation. So if you have, it's more easy to politicize health information if you have a population that doesn't understand that. And so we saw that a lot when we deal with COVID, when we're talking about vaccination rates or the impact of masking. I think anybody who had access to Facebook there saw the impact of this. But it also makes patients more susceptible to really quackery when you're talking about supplements and other conditions that are miracle cures. It takes a little level of understanding to recognize that if it sounds too good to be true, it probably is too good to be true. And to be able to really understand what is quality science, what is good science, and really even understanding what's the limitations of science. So one of the things we'll talk about is the fact that science is a process. It's not truth, but it's a process towards truth. And so if you have a certain level of health literacy, you can understand kind of the confidence levels around certain types of information that you're getting, so that you can understand why it happens that on Monday night red wine is good for you, and on Wednesday night red wine is bad for you. That type of confusion that we think that in absolute terms, a higher level of health literacy, you begin to understand kind of how those different interpretations might occur. This is just one study I thought nicely illustrated that impact of health literacy and how it really is counterbalanced with patients' engagement. So this was a study looking at patients' willingness to have COVID vaccine on there. When you look at vaccine hesitancy, a high level here meant that you were unlikely to get the vaccine. And what you found is that patients that were highly engaged in their care, so they're out there kind of looking for information, and they're out there on Google, on Facebook, and all the other sources that we find people typically searching for. If they have high engagement and low health literacy, they have a high level of vaccination hesitancy. They're engaged patients that really want to find out information, but they can't differentiate good information from bad information. And so they're, like we talked about in a previous slide, more susceptible to the type of information, misinformation that really is very challenging as a healthcare initiative across the country to counterbalance. Similarly, if you look at an engaged patient with high health literacy, you saw very low levels of vaccine hesitancy. So these are patients, again, that are highly engaged in their care, but have a level of health literacy that we're able to differentiate good information from bad information. And that's really the target population that we want to get. If you have low engagement, you really don't care. You're somewhat apathetic. You're not out there seeking out information, and you're not really using it in the management of your care. So it's really, when we think about health literacy, we have to think of it in the context of some of these other factors. One of which that's important is the level of engagement of the patient populations. And this is really kind of an example of what's the Dunning-Kruger effect, which you probably have heard about before. It's naturally human. That when we think about our confidence, it really has this bizarre relationship to what our confidence is, has this bizarre relationship to our competence. That is that if you know just a little bit of information, you really are overconfident in what you think you know about things. They call it the peak of Mount Stupid. It becomes even worse when you use things like the internet, because what happens is that you get in this echo chamber and you get a lot of information that reinforces what you think is the level of understanding, but you don't recognize the vast amount of material that you don't know. And I find it even when I'm teaching our own residents currently. It used to be the days of when you had textbooks. We have some textbooks. I'm a musculoskeletal radiologist. There's our big textbook is about 4 feet long. It's got 20 volumes in it. And so if you read one chapter in volume 1, you recognize the fact that there's still 5 feet of information here that I haven't read yet. I don't know this. And so you had a way of calibrating what your understanding is. But you go online, you read one article online, and suddenly you don't recognize the fact that no, there's a lot more out there that you don't understand. And so typically what happens is that you get more information back. You recognize, hey, I don't understand this. You fall into the valley of despair, and then over time, as you become really confident, you're better calibrated in what you know and what you don't know. And so this health literacy is really, we find a lot of people that have a relatively low level of health literacy, but are out there actively searching for it, that really overestimate their level of understanding of factors related to their health care, which is, I think, been problematic in a lot of public health areas that we've been working on. So improving healthcare literacy is a real health priority for the nation. I think a lot of things they recognize that if we really want to improve the health of our population, we need to have a better informed population. And so there's pressure on healthcare organizations to try to do this. There's pressure on getting information out at an appropriate level to patients so that they become better informed. So one of the things, areas that we look at are what are healthcare organizations, what can they do to improve health literacy? And the Institute for Healthcare Improvement is one of those healthcare improvement think tanks that helps organizations become more effective in delivering care. And so they just have some basic tools for providers when they're working with patients. So one thing to look for is when you go and talk to your provider, are they using some of these techniques? One is you really want to ask open-ended questions. So you don't tell the patient, here's what your medication and side effects are. Ask the patient, tell me what you understand about these side effects of these medications. Did you hear what I told you? And do you understand it in a way that you're going to be able, when you leave today, be able to recognize the things that we've been talking about? There's techniques in education, teach back and show back techniques. Tell me what you understood about the conversation we had, or in this example, show me how you use your cane at home. And you might go through some various steps to make sure that you verify that patients are understanding what's happening through that communication. One thing, and this is kind of interesting, but they must have some data to show that it works, is hand your patient the written material upside down and see if they turn it up, right side up to read. Are they actually even engaging with that information? If you hand it upside down and they just sit there with a blank stare on it, they're probably not understanding what you're telling them. And you might have to step back now and reapproach how you're going to communicate with those patients. One of the things I think all of providers, I find myself, a problem is use common language at an appropriate age level and in the appropriate language for the population that you have. So rather than using terms like abdomen, you might use belly, rather than talk about inflammation in the lower portion of your bowel. The other thing oftentimes they recommend do is use illustrations or videos or other visual tools that might help better inform the patient. One of the other ones that's, I think, very helpful that we're starting to use, particularly for patients with very complex disease, are patient navigators. Somebody that the patient can engage with outside of their day-to-day direct interaction with physicians to be able to say, hey, I had an appointment last week with my doctor, I was confused about these things, or what is the next step, or who do I contact if I have a question, or I have 20 things scheduled on my visit to the medical center next week. Help me get through this very complex process. How do I access my information on the portal? Those kind of basic questions. So these are some things I think healthcare organizations increasingly have to look at doing to be able to make sure that they're getting that information out to patients in ways that they're able to use it. I'll just show you an example of this. This is a conversation that I had last week with Allegheny Health Network on a disease condition that I do some work in, and that's osteoporosis. So just to give you a little bit of background, osteoporosis, which is the weakening of the bones, the loss of bone that occurs with age, is an incredibly common condition. It happens particularly in older women. We know that over 10 million Americans over age 55 have osteoporosis, and that's old data. That's from 2003 from the Surgeon General report, still one that we use. With the change in the demographic, it's probably a lot higher than that. There's over 1.5 million fragility fractures in the U.S. each year. These are fractures that occur with relatively minor trauma that are due to not the fact you got hit by a truck where we expect you to have some fractures, but you slipped on a rug or you had a minor fall and you had fractures. And so common ones there are like hip fractures or spinal compression fractures. So we have certain types of fractures that we look at, and those tell us that there's probably an underlying problem with the strength of the bones. But what you find is that only about 8% of Americans are on appropriate treatment or have even been tested to see if they have osteoporosis. So that's a real problem, because if you come in with a fragility fracture, you have a very high risk of coming in within the next year of having another fragility fracture. And we know, for example, in the older population, hip fractures are associated with a high level of one-year mortality. You get a hip fracture, you're going to become disabled, and over time your health care declines relatively quickly.
What's the reason for that?
Most of it is loss of mobility, and then the other things that come from loss of mobility. So with loss of mobility, they also lose muscle function. So we're also looking at muscle wasting that occurs with aging as well. And both of those are very highly associated with decline in overall
So a
health
lot of
condition.
nerves and blood vessels flow through that area and they've been disrupted.
Yeah. It's kind of those things, if you don't use it, you lose it. And so just a longer rehabilitation. So patients are starting out with a lower level of health conditioning. And so when they undergo this prolonged period of bed rest and the other things that are associated with it, puts more stress on the rest of their health system. Oftentimes then they're in pain, they're not eating, lots of other things that can come with it as well.
What on an X-ray shows you that they have osteoporosis?
X-rays itself, obviously the ones we look for are like examples of fractures here. There are some things that we can look at and we can estimate that there's probably a level of osteoporosis, but there's better tests for it. DEXA is the most common one that we have, which is a quantitative way of measuring bone mineral density in the femurs and in the spine. And so that would be the next test that we do it on. So if we saw patients that have fragility fractures, one of the things we'd want to be able to do is say, you need to get a DEXA, and this is some medications that you should go on. And so some organizations have done just that. What they do is they say, okay, if you have something that says you have a fragility fracture, let the EMR automatically pop up and say, here's an order for getting a DEXA, Here's the appropriate treatment for that level of minerals, and you just build it into a patient workflow. So all the physician has to do is hit click, yes, order that, and they go on and do it. And if you do that, you find that you go from about 8% over to 30%. So you don't get a big jump in that, because a lot of patients don't understand the fact that your underlying osteoporosis is a pretty serious medical condition. You don't feel bad from it, you don't necessarily feel, you feel the fracture when it happens, but the osteoporosis itself may not be something that's on your mind on a regular basis. It's really something that what we're trying to do is prevent a future event that is going to be important in your management of your health care.
To what degree can you reverse it?
There are some medications now to reverse it. Some of the older medications were really relying more on anti-resorptive therapy, we just kind of keep it from declining at a fast rate.
Mm-hmm.
But, I was talking to a dedicated clinic they had in Allegheny Health Network, and something we're trying to start at the medical center, is they actually spend a large amount of time educating the patient. So all the patients come to a central clinic, and there's a nurse navigator that will spend a half hour with them, talk about their medication, and talk about their disease, and talk about what the complications of those diseases are. And then we'll call them back up a year later, or even a few weeks later, say, did you understand that? Did you get up your medication? They follow it up. And they're able to get 75% converted over to that. So this health education, the health literacy component, is a really significant component of being able to manage this complex problem of osteoporosis. And so when we're thinking about building a program, then the health literacy has to be a primary function of what one of the things that program has to do. In order to get good outcomes, you need to have well-informed patients. So those are some things that a healthcare organization needs to be thinking about to be able to get better health literacy in their patient population. But there's a lot of things that patients can do also to improve their own health literacy. And probably one of the most important things is really to find reliable health information. And I kind of think about when you're going out there and you're looking for information on a condition or a medication that you have or something that you want to learn about. There's three, I'd say, basic areas that you can begin to search. One is looking for government sites. So they get funding to develop this information. So the Department of Health, the CDC, the Office of the Surgeon General, they all have different online areas to get good basic health information that's been reviewed by scientists, that's been vetted, that's on there. One of the ones I really like is Medline Plus. Medline is the Natural Library of Medicine's search engine that we use to go out and look for literature about any of the conditions. So when I'm doing research and I need to go out and find what articles have been published on this topic, we use Medline. Medline Plus is really designed to take that information and put it into lay terms. So kind of show you an example of the type of information that's there. So if you went on to Medline Plus and you were interested in the health topic, so say we were interested in osteoporosis, you could go down and search for any of these conditions. And there's, as you can see, there's lots there. And then you can go on and get good basic information about osteoporosis. So if you want a summary about what is osteoporosis, my doctor mentioned this term, I don't know what it is. There's good definitions there. There's links to other information on osteoporosis. So it's a great starting point to be able to go in and find basic information about some of those conditions. The other one I like are some of the larger health systems. Mayo Clinic's got a really good one. Harvard Medical has one. The thing I don't really like about that is that they tell you just enough to get you interested, and then if you want all the information, you have to send them $35. So that's not, I don't really like some of that, but actually it's not showing up on there. Let's make sure we're on the right display center.
Even if you're reading a good article, oh, you want to register this? Sign up here.
Get you in.
So like Mayo Clinic's, you go in and you can search by certain symptoms that you have, or if you know you're coming up for a test and procedure and you want to understand, what is the CT scan I'm having, or different drugs and supplements. So, well, since we're on osteoporosis, we'll look at that and say, my doctor put me on this new medication, Forteo. I just went online and it, it's almost $4,000 a dose. What is that I'm taking? You know, so you could go on and you can get some information about, you know, what this medication is. It tells you a little bit about it's there to treat osteoporosis. You know, who is it appropriate for? You know, what is it? You know, it's for patients that are at high risk for bone fractures. These are one of the medications, Jack. You asked if there's something that you could use to reverse it. This is one of the ones that are out there. They're called anabolics for osteoporosis. And they all cost about $5,000 a dose, so they are rather expensive.
But the problem with some of these new medicines is the side effects are worse than what you have.
Yeah, so be careful. And
I mean,
those are,
why roll the dice and spend $4,000 a shot
yeah.
and not get any better and get side effects that make it?
And so that's what, you know, one of the things that like a site like this oftentimes, here are the common side effects that you need to really be thinking about, looking for when you go and make that decision to go on this medication. Here are some really, you know, concerning side effects, but they're very rare. You know, and those are oftentimes the kind of decisions that you as an informed patient need to be able to have. You know, I heard about, you know, one of the things we find from osteoporosis is I'm not going on that medication because a friend of my aunt's mother, you know, had it, and she had a leg fracture and, you know, was in the hospital for that, from it, and I don't want that happening to me, so I'm not gonna take that. Well, really what you have to understand is, you know, that is a complication. You get these atypical insufficiency fractures, but how often does that happen? And what is the relative risk of those side effects relative to your risk of not taking the medication? And you as an informed patient, if you understand it better, then you're able to make that assessment. Because it's ultimately is up to you to be able to make some of those types of, you know, educated, informed decisions, but you need the right information to be able to do it. And then the other ones, oftentimes that are really good, is you can go to different professional organizations, or there's patient advocacy sites that are out there. So this is one, you know, the Bone and Health and Osteoporosis Foundation. So if you were, again, if you were looking for osteoporosis, there's a national organization. They, almost all of them will have some information about for patients. If you go on to patients, you know, on their website here. And one thing I think is good, you know, we'll have you know, here, questions to ask your healthcare provider. You know, so before you're going to talk to your physician about healthcare, you can print out this checklist and say, here are some questions that you need to be thinking about before you go see your provider, or here's questions you might want to talk to your provider about. And so there's a lot of these types of resources that are available on these, you know, patient advocacy type groups that are kind of bringing patients with different conditions around, getting them informed about it, you know, helping to drive research. And almost every disease condition will have one of these organizations. Or if you were interested in looking at a professional society, the American College of Orthopedic Surgery has a lot of information on osteoporosis. So those are oftentimes good things, places to go. So if you look at, you know, from those government sites that are good kind of warehouses for information, large healthcare systems that you're familiar with, and you're respected in the field, and then looking at some of these national organizations, those are good starting points. Typically, if you go into Google, you will find those on there, but they don't always come up first. Oftentimes, what comes up first are somebody who's going to try to sell you supplements to improve your bone health or a miracle cure. So those are kind of things you really have to be careful of. So another important thing is, you know, really be an engaged patient. We talked about before about that level, the interaction of engagement and health literacy. So to be, you know, have good health literacy, the first thing you have to be curious. You have to want to understand that information, learn about that information. So a couple things I think that are very helpful. One is know how to log on to your patient portal and use it, you know, access it. If you have questions, that's a very helpful way to get in touch with your physician, because it can be done off hours. You know, you can send them a question and, you know, maybe they're on vacation or they're busy in clinic, but then they or somebody else, one of their colleagues, can get back to you about questions that you may have. Make sure that you're following up on tests you have performed. This is one of the things I think is really important. A lot of patients assume, well, the doctor never called me about that test result, so it must have been a fine. And, you know, I said, rule number one, no news is not good news. You know, every test that you have, you ought to be following up for. I had that blood draw for that test. I never heard back on what the results for that were. I had that CAT scan. I never heard back what they saw in that CAT scan. So you want to make sure that when you have a test, write it down on a list, and then put a checkbox next to it when you follow up on it. And if something's out there that's not followed up on, follow up on it, and be engaged about it. Make sure you understand why you got that test, using some of those sites that we talked for. Make sure you keep a list of all of your current medications, with the dose and how frequently you take them, so that you know what you're on. And also understand why you're on. Go into some of those pharmacy sites that we saw, like the Mayo Clinic one. If you don't understand what that medication is, you can look it up, you get information. Here's the drug name, here's the generic name, here's the typical dose that you're on, here are the side effects that you're looking for. Those are important things.
Just a comment about that is on the Penn State portal, they will list your drugs, and you can always check to see if they're correct anytime.
That's a great point, Jack. Yeah, you really want to do exactly that. Make sure that everybody's working from the same sheet of music, so to speak. That what they have as your medications are what you have. Because oftentimes it might have been that you saw another provider that wrote a prescription for you, and that might not be on your health records. And that might interact with a medication that you're also on there. So these interactions really are important, that you understand not only all the drugs that you're on, but also any supplements that you might be taking. Because some of these supplements will also impact what those medications are. So, keeping that on this. And then also a list of your health-related questions. So, a lot of times, the important things are the things that just pop into your head at the heat of the moment when you're at your appointment. You need to kind of keep a list of, here are the things that I've been thinking about or I've noticed in my health that I have a question about, and write them down so that you remember them. I think one of the things that helps in getting prepared for your doctor's visit, recognize that nowadays, a follow-up visit is typically 15 to 20 minutes. So you want to have a list, but you really need to prioritize it. What are the 1 to 2 things that are really important? You walk down, you sit in the office, and say, are there any questions? Then you pull up, book the 5 pages of, we're going to be here a while. The first thing is on the physician's mind is, okay, I've got like an hour and a half behind on my appointment slots, and I'm not going to get through this. You need to be able to prioritize. What are the things that are really important to you? You might not understand that beforehand, and sometimes, going on your patient portal and writing some of those questions will help to prioritize. Or you might say, I have a lot of questions. Here are some general things to think about. What should we focus on at this discussion? What are the things that are really urgent that I need to take care of? You should always have a list of your prior surgeries and medical problems, particularly if you're going and seeing a new provider. Most of that will be in your medical record if you have it, but it's not always. And again, you want to verify that that's the case. Again, you want a list of all your medications and supplements you're taking. Some people say, put it in a bag and bring it. That way you can look at, you can go through it and say, yeah, I'm on this medication, that medication, you understand kind of what you're on. One of the things that's really important is in the diagnostic process. Being an informed patient about how you communicate that to the provider is really important. You're the person coming into this relationship that understands your condition better than anybody. So you need to understand kind of what are the symptoms you're experiencing, and be able to describe those. Is it pain? Is it dizziness? Are you lightheaded? Are you feeling confused? What are those symptoms? And what is the timeline? When did it start? And so writing these down and kind of keeping track of it is important. And then you want to know how your symptoms might have changed. Are they changing over the last day? Has it been over a week? Has it been over a month? Those are really important to kind of help in this diagnostic process. What have you done that makes it feel better or worse? Do you have anybody else that you live with or are in contact with that are having similar symptoms? Particularly important when we're thinking about things like when we're talking about COVID or RSV or flu or infectious diseases. Those are really critical. Have you had similar symptoms in the past, or are there family members that had similar symptoms in the past? So those are kind of things that are really important to be able to communicate, and writing them down and organizing those thoughts really are very helpful in preparing for your doctor's visit. And then one of the other things is, bring a friend or a relative with you, because they can be hearing it as well. And oftentimes it's like, this is what I heard, and particularly like this, when it's a really life-changing diagnosis, you're going to hear about that you have cancer. Well, you're not going to be in your best mental state to be able to take in all the information in a very organized, structured way. You need somebody else there to that can manage that part of it. Because these oftentimes can be somewhat overwhelming discussions. And when you're at the visit, really be open and honest regarding your health. Kind of holding things back because I'm embarrassed by this, or I don't want to talk about this. Oftentimes, just simply delays, kind of addressing those issues. And they're going. Most physicians have heard a lot of it before. You're not going to be the first person that's kind of come in with a lot of these conditions. It helps to be, if you have a question about something, you want to be honest with it. Make sure you understand the information presented. So if you heard the physician say something, you're a little confused, just do that teach back to them. This is what I heard you say. In my terms, here's how I'm putting it in my language, this is what, my understanding is correct. And that way the physician will understand your level of understanding, and if it's wrong, can redirect the conversation or say, no, that's right, that is the way, that's what we're going to be doing for. Ask clarifying questions. If you just got put on a new medication and you heard about some of these severe side effects stuff, what side effects should I be looking for? What might happen in the next week, 2 weeks, or months when I start taking this medication? And what is going to be important that I need to contact you about? I need to call you if I start to experience this type of, and make sure that you understand kind of being able to prioritize and use that information in a way that's effective in your healthcare. And then understand the process for following up. When you leave, you ought to know what the next steps are. You're getting, you ordered some tests. Okay, when will I receive results of my test? Who's going to contact me? For those that are going to be on the patient portal, do I contact you? Will somebody be calling me about those tests? Understand who and how you're going to get those results. And understand kind of what any follow-up is. If I have a condition and I'm concerned that it might be getting worse, what specifically should I be looking for that would mean I need to cut in touch with you? This is something that says, hey, my condition is going different, or maybe we have the wrong diagnosis and I need to get back to you. So understanding, kind of the things that would mean I need to take action and re-engage with the health system. So those types of kind of reinforcing questions are really important at the visit. So just to summarize, a couple things that I wanted to just again bring home. One is really the importance of health literacy as a public health issue. We're going to address a lot of things related to their outcomes in healthcare, lowering the cost of healthcare. Healthcare literacy in the population is really important. And that's going to require changes occurring both on healthcare providers and getting a more informed, engaged patient population to be able to use that health information. And then we talked about some of the specific actions, both that healthcare organizations are going to be looking at to try to improve healthcare literacy and some of the things that you can do to become a better consumer of health information. So that is the presentation. So if there's any questions that people might have.
I have a comment, having worked the health insurance industry, that if you're on Medicare Advantage plans, everyone I've seen will, A, they will give you a free membership to a gym, and B, they will be willing to send an RN to your house for free to go over your health information. So the insurance companies are really want to be proactive also.
Absolutely. Well, for a lot of the provider organizations are driving some of that, using those nurse navigators, using provider extenders to be able to go into patients' homes to be able to make sure that they're informed.
Mm-hmm.
But a lot of times, one of the things that they might do is look around the home for fall risks.
Mm-hmm.
You're in a house with multiple throw rugs over there and small dogs. Okay, this is going to be a problem that we see here. But I think they're recognizing the fact that we can make a lot of impact on health outcomes if we do exactly that. Informed patients, they understand, what their condition is. They're being more compliant. They're going to follow up, and that investment ultimately is better for the patients, better for the health system.
And emphasize that they do it for free.
Absolutely.
Yeah.
They're willing to make those kind of investments because most of the time you find that those investments in improving health literacy turn around much better outcomes. They're well worth the investment.
One other comment I have some experience with. A lot of these expensive medications, nothing wrong with researching how you can get financial help and Because you might be surprised, some of them, it's not too stringent, their qualifications aren't too stringent, where you can have the cost cut down or even eliminated. And I'm just saying to the public out there, it's worth, if you have a medicine that's $1,000 a month or something like that, it's worth seeing if you can get financial help with that. And you don't have to be poor to get it.
No, absolutely. Some of these medications, if you don't do that, you could be poor.
Yeah, yeah,
So it's,
good point.
You know, a lot of these new infusion therapies and biologics that we talk about for these chronic diseases, you have to take them frequently. The thing is, oftentimes they're effective, you know, and they do work. But I think that's also then part of being your healthcare literacy is understanding what those costs are, and then how do you offset some of those costs so that you can take the benefits of those medications and not hopefully feel a lot of the financial hardships. Because some people, if they're not an informed patient and say, I can't afford that, I'm not going to take the next step to learn about what are some of the options I have, I'll simply just be non-compliant.
It's kind of tough when your life's at stake and you have to make that kind of
Absolutely.
decision.
It is. Do I, you know, eat this month or do I take my medication? And that's some of the, you know, with the healthcare disparity, some of the things that the patients are dealing with. All right. Thank you very much.
Thank you.
Thank you.
Thank you. Are we off?
Not yet.
Yeah, there's other topics.